content of this show are those of the host, guests, and callers. They do not necessarily reflect those of Cook Broadcasting, LLC, its owners, partners, affiliates, assigns, or heirs. Having said that, it's now time to say good morning, St. Johns County. Welcome to the weekly radio show of the St. Johns County Council on Aging, better known in our community as the COA. We are your local nonprofit agency who for the past 52 years has been leading and advocating for the dignity and independence of seniors and responding to their changing needs. I'm Brian Robinson, Program Director for COA, broadcasting to you live from the studio of WFOY 102.1 FM, your local radio station for news, sports, and talk. Before we get into our show, let me remind everyone that if you have a question, comment, or a suggestion for a radio show topic, you can send that by email to radio@coasjc.org. Again, that's radio@coasjc.org. And if you have a question during this morning's show for our guest, you can send that as well. I'll have my email up in front of me, and we'll try to work your question into the show this morning. On today's show, we are reminding everyone that May is Mental Health Awareness Month. Established in 1949, Mental Health Awareness Month seeks to reduce stigma, educate the public, and promote support for mental wellness. One place in our community that provides such support is Epic Behavioral Healthcare. For over 50 years, Epic has empowered individuals and families in our community to overcome mental health, behavioral, and substance use challenges. Here to tell us more about their programs and services is the CEO of Epic Behavioral Healthcare, my good friend, Nangy Pulsfus. Nangy, welcome back to the COA Weekly Radio Show.
Thank you for having me, Brian.
It's always good to have you in the studio. I will ask you to move just a little bit closer to the microphone. There we go. So
okay.
we're picking up your voice because we want to hear everything that you say this morning. All right. Well, in this first segment, I just want to talk about, the fact that Epic and Council on Aging, we've both been a part of this community since becoming incorporated in 1973. And both of us operate as registered nonprofits, but it's surprising how often we still meet people, and we've talked about this before, who are not familiar with the work our organizations do. So with that in mind, in this first segment, just take some time, tell our listeners, help them to get to know Epic Behavioral Healthcare a little bit better, and share an overview of Epic, the history, locations, programs, and services you provide. And then we'll dive a little bit deeper into some of the other programs and services that resonate a little bit more deeply with me. But in this first part, just give an overview, if you would.
Okay, sure. Epic has been serving our community since 1973, starting as the Jam House on Charlotte Street. Today, the organization has expanded to include 4 outpatient locations in St. Johns County, an outpatient clinic in Flagler County, a sober living village, and an inpatient detox, residential, and medication assistant recovery service. We offer affordable, comprehensive services to individuals ages 4 and up for mental health and substance use disorders. This includes evaluation and assessments, individual and group therapy, family therapy, crisis intervention, medication management, support groups, recovery activities, and prevention services for our youth. We work with our community partners, including St. Johns County Sheriff's Office and the Circuit 7, to provide co-response teams, jail-based transition teams, in-jail intervention programs, Veterans Court, and Drug Court. We also work with Ascension St. John's and UF Health St. John's to provide bridge programs and services, and DCF to provide family therapy coordination. This is a brief overview. I do encourage anyone who's interested to learn more about the specific location and services to visit our website at epicbh.org.
Well, that's fantastic. I love listening to all the overview of everything that you do. And you probably have people, when you're telling them about everything that you do, we get this from time to time when we're talking about what we provide. And folks are like, oh, my gosh, I didn't realize you did all of that. Do you experience that?
All the time. Absolutely.
Yeah. And then you probably still get people asking if you're connected to the Epic Theater.
All the time. Or the electronic health record.
Okay. You just need to start saying, yes, that is our movie theater. How are you liking the new design, right?
It's so true.
Well, that's great. But it's great to just hear everything that you provide. So it was first called JAM. What did that stand for?
It was, I can't exactly recall what it stood for. However, it was a group of advocates for the youth.
Okay.
That were dealing with mental health issues.
Okay, great. And then it's just... that was the root, and then it's just grown into what it is today. And it's so fantastic to see everything. All right, so we're going to jump into this next part, and we might get interrupted by a commercial break, but I want to highlight a few programs and services that really resonate deeply with me, because offerings like these, even though they were experienced with a different provider than Epic, but they've made a meaningful difference in my life and in the lives of people that I love. And so the first thing I want to talk about is your 3-tiered recovery center program. And the reason this resonates with me is that my father, who passed away in 2004 from lung cancer, was a recovering alcoholic. In fact, it was in recovery that he and my mom, who was a nurse, met. And so if it wasn't for the recovery center in Weirton, West Virginia, where I'm from, I would not exist, and we would not be sitting here having this conversation. So I just think about, there were different times in my life when my dad, it was a lifelong struggle for him. And, in my earliest memories, I remember from my earliest memories on, he did well, right? He went to the AA meetings, and did very well. But there were times when, as the saying goes, he fell off the wagon and would then go back into a recovery center for 30 days. And so I'm so grateful that it exists, right? And so tell our listeners a little bit more about your 3-tiered recovery center program.
That's a nice story about your parents, how they met, Brian. Our substance use recovery program offers the 3-tier process. The first is withdrawal management, formerly called detoxification. We now call it withdrawal management. This is an inpatient unit on US 1 South, where clients are medically monitored and assisted through the process of withdrawing from substances. The average length of stay is 4 days, but it can be up to 7 days. The next phase, they transition, if they elect to, they transition to our residential program, which is a 30-day program, where they're focused on life skills, continue to focus on their sobriety while receiving care coordination, peer support, group therapy, and one-to-one counseling. The third phase is our sober living village. The village has 8 units and can house up to 43 residents, including 2 units that are dedicated to women with children. We really like to unify, get the parents back with their children. We offer peer support and vocational assistance at that location. Clients can live in the homes for up to a year.
Wow.
And we help them with transportation, gaining employment, getting back their driver's license, and really learning those life skills while continuing on their sober pathway.
That's fantastic. And then, so how is it paid for? Is it something that a person's insurance pays for, or they're paying out of pocket, or is it covered by donations that come to Epic?
A little bit of all the above. So the first couple of weeks, of course, they're just coming out of inpatient and usually do not have employment. So we help fund their first couple of weeks and help them find employment, and then they pay weekly rent to us.
Okay.
Very affordable. And there's a sliding scale for that. We also receive some donations and some funding from LSF, DCF to help.
Well, that's fantastic. Well, if my lottery ticket ever has the winning numbers, I'm definitely going to donate so that we can continue to make that program and all the other ones help more and more people. Because I just have such a heart for it, and I'm so glad that you and the incredible staff that work there are doing the work that you're doing. So we're going to go ahead. We're going to take our first commercial break. We'll continue this great conversation this morning. We'll be right back after these messages. And welcome back to the weekly radio show, the St. Johns County Council on Aging, here on WFOY 102.1 FM, your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for COA, joined this morning by Nangy Pulsfus, who is the CEO of Epic Behavioral Healthcare. And our topic today is Mental Health Awareness Month, and that takes place in May, established in 1949 to reduce stigma, educate the public, and promote support for mental wellness. And so that is something that Epic has been doing since 1973. Started out as JAM. I think I like that name. Maybe you should go back to that. And serving youth, and then it has just evolved into what it is today. And in the first segment, we were talking about your 3-tiered recovery center program, which I stated was near and dear to my heart because of my dad being an alcoholic, a recovering alcoholic, and just knowing that he had that help from professionals to help him through that, help make his life better. And it's great that you offer that to help folks on their recovery journey. The second offering I want to highlight is your psychiatric services, which help diagnose, treat, and prevent mental illnesses. They include medication management, therapy, and other therapeutic methods. As someone who has personally battled depression off and on since a teenager, I am grateful for the men and women who have dedicated their lives to the field of psychiatry. So if you would tell our listeners, give a more in-depth description of your psychiatric services.
Sure. So we have board-certified psychiatric nurse practitioners who provide psychiatric evaluations, diagnosis, testing for ADHD, and plans for treatment. Treatment may include referrals to our clinical counseling teams for therapy, hypnosis, EMDR therapy, and medication management.
I think one of the keys, too, for folks to realize is that sometimes it's a trial and error experience. Sometimes you have to try a medication for a little bit to see if you respond to it. Sometimes you do, sometimes you don't. And so there's for the patient, there needs to be some patience as they go into it with their psychiatrist, because sometimes you just have to explore what's going to work. And so my assumption is that takes place with your psychiatrist as well.
It absolutely does, yes. And very often it's receiving counseling at the same time, psychiatric services. And to your point, medication, there's a place for medication, but there's also a need for expanding treatment options outside of pharmaceutical.
Yes, absolutely. And I'm glad that you bring that up, because sometimes, some psychiatrists or medical doctors in general, right? Sometimes they may be a little bit quick to just throw medication at it and not pursue the root of it. And so it's important. I'm glad that you brought up counseling too, because for me, I finally, I mentioned I struggled with depression since my teens, but because of the stigma, I never got help until my mid-30s. And I'll talk a little bit more about that as our conversation continues. But, so I was able to see a psychiatrist and get on medication, what I could not afford at the time, because at that time, the insurance I had did not cover counseling. So I couldn't do the counseling. And one of the things that I've experienced this year is doing some counseling, and it definitely makes a big difference when the two are paired together, because the medication is helping you get stabilized, and then the counseling is helping you dig into the root of the problem to try to heal from it.
Indeed,
right?
Yes.
And so it's good to have those two coupled together. And then, so that brings up one that I'm very excited that you are, I know we've talked about this recently, that you are looking into bringing the what's known as eye movement desensitization. Give me more than 4 syllables and I can't pronounce it. Eye movement desensitization reprocessing, better known as EMDR therapy, and that's probably why, because there's too many big words in there. EMDR therapy. This therapy is an effective, evidence-based psychotherapy designed to help people heal from trauma, PTSD, and other distressing life experiences. I've personally experienced the impact of this kind of therapy, and it has genuinely been life-changing for me. And that's why I'm thrilled that you're going to be offering at Epic. So can you share more about that?
Absolutely.
Or when is it going to be offered? And
we're doing it now.
Yep.
Yep.
Fantastic.
We started a couple of weeks ago. So EMDR treats mental health conditions that happen because of memories of traumatic events in the past. It doesn't require any detail about the distressing issue. Instead, it focuses on changing the emotions, thoughts, or behaviors resulting from the trauma. This type of therapy allows your brain to resume a natural healing process. While many people use the words mind and brain when referring to the same thing, they're actually very different. Your brain is an organ of the body. Your mind is the collection of thoughts, memories, beliefs, and experiences that make you who you are.
Mm-hmm.
The way your mind works relies on the structure of your brain. That structure involves networks of communicating brain cells across many different areas. That's especially the case with sections that involve your memories and senses. That networking makes it faster and easier for those areas to work together. That's why your senses, sights, sounds, smells, taste, and feels can bring back strong memories.
That is very true, and I have definitely experienced that. And what's just to give a little description of it, so you have a few options, and sometimes folks will do all options when you're doing the therapy. For me, there is what is a light bar, and so there's this red light that goes back and forth from side to side, and then you have the option for paddles that you hold on to, and it sends a little buzz to the paddle, and it is synced with the light. And so when the light is on the right side, then your right hand is buzzing. And then the other option is to do the headphone option, where a sound goes in. And the idea behind it is accessing both sides of the brain. And so the evidence of all of this shows that doing that allows the brain to process memories a lot quicker than just the typical talk therapy that sometimes you are in for months or maybe years, and not just be able to discover some of the things that you are through the EMDR therapy. And to give you an example, I had a traumatic event, and I won't go into the details on the air about it, but the memory that I had of it ended up being different than what I actually experienced, which I discovered through the EMDR therapy. I remembered the incident up to a point, and then the EMDR therapy helped me to go beyond that point and discover some things that I had forgotten, which ended up being very, very helpful for me to remember that part of the experience, right? But then also the idea too is, especially if you have trauma from your childhood, and now you're getting to experiencing the trauma as an adult, and your adult mind is looking at it and observing it and seeing it from an adult perspective, right? And the therapy helps it to become less traumatic in some instances. And I realize that that's not always the case, because some traumatic events are a lot worse than what other people experience, and like for me, it definitely is not at the same level as somebody who's been to war, and or maybe somebody that was involved in a mass shooting or had dealt years of being abused sexually as a child. So mine's not at that level. So but trauma is trauma.
That's right. And
it impacts you, especially if it is during your childhood and your formative years. And through this, I discovered so many of the different ways, negative ways that I thought about myself, and I discovered the root of it. And I was like, oh my gosh, that's where that came from. And then just being able to realize that and process it and help me see it differently, it's just been liberating for me. Liberating.
That's awesome.
And that's
after
really,
all these years.
Yeah, and that is the word that just keeps coming to my mind is liberation. And I'm so glad that you're offering this for folks. Do you have one therapist doing it, two therapists? How many you got?
Right now we have one therapist, actually a psychiatric NP, nurse practitioner who's doing it, but we're also sending another one of our counselors to receive training.
Fantastic. Well, I am so excited about it, and if you need a spokesperson for it, I will be happy to do that for you, because it has been tremendous for me, and I can't say enough good things about it. All right, well, that music means it's time for our next commercial break. We'll continue our conversation right after these messages. All right, welcome back to our weekly radio show, the St. Johns County Council on Aging, here on WFOY 102.1 FM, your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for COA. And next week in the studio, I will have Megan Wall, Managing Attorney of the St. Johns County team of the Jacksonville Area Legal Aid, will be my guest. And you have heard from her before, and she'll be in the studio again. And it's always good to have her in talking about different topics that pertain to seniors as far as legal matters go. But my guest today is Nangy Pulsfus, who is the CEO of Epic Behavioral Healthcare. We've been having a wonderful discussion focusing on May being Mental Health Awareness Month, and we've been talking about the different offerings that are offered at Epic Behavioral Healthcare. We talked about the Recovery Center program, and we talked about psychiatric care as well. And now I want to shift, and we talked about EMDR therapy that's coming, and very excited about that. And so if you're interested in that, you will definitely find things about it. Just Google EMDR therapy, and you will find lots of information out there about it. And then if you're interested in it, contact Epic, and they'll try to get you in with somebody to get that started. So great that you're offering that. So I want to shift our discussion back to the topic of depression. It's important to emphasize that depressive disorders do not present the same in everyone. And although the term high-functioning depression is not a formal clinical diagnosis, this is what my physician used back in my 30s to describe my experience when I was diagnosed with major depressive disorder. And as outlined by the National Alliance on Mental Illness, this term is often applied to individuals who exhibit clinically significant depressive symptoms while still maintaining daily responsibilities and outward functioning. And so I share this because it underscores a critical point. Depressive symptoms can manifest in diverse and sometimes subtle ways. So it's different for everybody. And so with this in mind, what signs should individuals be aware of, either in themselves or in those that they care about, that may indicate the presence of depression?
Good question. So the initial early warning signs of depression can include persistent low mood, sadness, loss of interest in hobbies, social withdrawal, fatigue, sluggishness, sleep disturbances, difficulty concentrating or making decisions. Sometimes people have angry outbursts or irritability, even over very small matters. Ironically, anxiety, agitation, restlessness can also be a sign of depression. For people with depression, symptoms are usually severe enough to cause noticeable problems in day-to-day activities. Some people may feel generally miserable or unhappy without really knowing why. For older adults, depression symptoms may be different or less obvious, such as memory difficulties, personality shifts, physical aches, fatigue, loss of appetite, and sleep problems, not caused by a medical condition or medication, often wanting to stay home rather than going out to socialize or doing things that they would otherwise enjoy doing.
Yeah, so a long list of things there. And, for me, one of the things, too, was there's just this feeling of hollowness. Like you feel hollow. And I remember I've done a lot of reading over the years. And, one thing I read as well is, when you're depressed, a lot of times we bring up, and you talked about it there, is about, feeling of sadness. But there's also what happens too is there's just this loss of feeling. Like you don't feel sad. You don't feel happy.
Yeah,
it's
apathetic.
It's just like you're a shell of a person is really the only way I can describe it. And so, the book that I was reading, it said, if you are feeling sad, that's actually kind of a good sign that you might be headed out of your depression, because at least you're feeling something.
Yeah.
At least you're feeling that sadness. So, the key is if you're hearing that list of symptoms and that's something that you are experiencing, or you see that in somebody else that you love, help is available.
Yes.
That is why we are doing this. And that is why I try to be an advocate for mental health and do a show like this. And let's erase the stigma.
Yes.
Right?
Yes.
Let's erase the stigma. I mean, nobody says anything if I, hurt my hand and go to the ER and oh, you broke your finger and they got to put a splint on or whatever, right? And nobody thinks anything negative about me, right? I mean, unless I broke it because I did something stupid and they're like, you're so clumsy, right? But when it comes to mental health, it's like, there's still a stigma that's going on.
It's true.
And we need to get rid of that stigma. And it happens by doing what we're doing today and having places like Epic Behavioral Healthcare doing what they do and being in the community and educating people and saying, hey, it's okay to not be okay, and it's okay to get help. One of the programs that I love to talk about is the BRAVE program that, Flagler Hospital Care Connect does. I mean, that has just taken off, and that's geared towards teens.
Yes.
Making sure the teens can feel comfortable saying, hey, I'm not okay, I need some help. So if you're out there listening and you've heard some of these symptoms, and please get the help that is out there for you, because there are people who care about you and they want you to be able to get up every day and experience joy in your heart and in your mind and in your soul and in your body. And they are there ready. They've spent their lives studying and preparing to be there for you to help you through that. So
there is a solution.
There is a solution. All right. So depression, it can develop gradually and sometimes it can go unnoticed, but there are moments when individuals experience a mental health crisis that requires immediate intervention. In those situations, rapid access to support can be life-saving. So let's talk about, we might get interrupted by a commercial break, but let's talk about the 988 helpline, and then let's talk about your co-responders program. So first talk about the 988.
So 988 is a resource for everyone. It could be a person in crisis, a person that is concerned about a person in crisis, people unsure if the situation is a crisis and trying to figure out. Anyone can call. People can call the hotline together. They can do it individually. There doesn't have to be a crisis necessarily to make a call. People can call 988 for support or to talk through a problem. You can also text 988 or chat with them through their website. Many 988 call centers can link local resources and at least refer for help and assistance. For our co-response team, we now have 2 co-response team, and that's in partnership with the sheriff's office. Mm-hmm. So we have a deputy and a clinician who ride along together and are dispatched to situations that need assistance with de-escalation, typically. Sometimes they're there for 2 hours, sometimes even more. But the diversion rate from Baker Acts is pretty tremendous, and they can link these individuals up with the resources that they need. Not the hospital, not the jail, but getting them the outpatient services that they really do need. Mm-hmm. It's been very successful, and Sheriff Hardwick's very, very pleased with it.
Yeah, fantastic. All right, well, we're going to take our next commercial break here right now. Okay, I was waiting for the music to kick in. All right, we're going to continue our conversation right after these messages. And welcome back to the final segment of the St. Johns County Council on Aging Weekly Radio Show. I'm Brian Robinson, Program Director for COA, and this is WFOY 102.1 FM, your local radio station for news, sports, and talk. And my guest this morning is Nangy Pulsfus with Epic Behavioral Healthcare. And prior to the commercial break, we were talking about the 2 rapid access support programs. We're talking about 988 that somebody can call, but also your co-responders program. And this is a licensed therapist that is with a sheriff deputy that go out onto the scene to help de-escalate a situation.
Yeah.
And one of the things that you brought up is it has helped prevent folks from being Baker acted. Would you just talk a little bit more about that? Because I think there's folks out there that don't know what the Baker Act is.
So a Baker Act is instituted when someone is a danger to themselves or others. And it means that you are involuntarily placed in the hospital. Usually you go into the emergency room, you have a psychiatric visit, and you may end up having an involuntary admission to the behavioral health unit. Sometimes it's not necessary, sometimes it is. It's hard to say, but most people who are living with mental health disorders fear that involuntary admission. It's better to avoid that and get them linked with services on an outpatient basis and help them get healthy without having to be institutionalized.
Mm-hmm. It can be a scary experience.
Very.
Especially if you're dealing with a mental health crisis, to be put into the hospital involuntarily. And so the goal is to try to prevent that when necessary, when you can. And sometimes, and the psychiatric evaluation, they determine, after speaking with the person, are they a danger to themselves or someone else, and then they have to determine and make that decision. But it also helps if the person has a good support system in place.
Yes.
To help have a plan in place to help keep the person safe. So I'm sure that's a very difficult decision for the person doing the evaluation to make, but they're trained on how to do it. But it's so great that you have this and that you offer it and that you're on the scene trying to intervene And I like the fact that sometimes you stay there as long as you need to.
That's right.
To help the person. I got to meet one of your new co-responders yesterday. She actually stopped by because she's helping someone that falls into the senior age demographic. And so she was stopping by to get some information on what we could offer and so forth. So
nice.
It was nice to meet her.
Love that.
And I told her that you were my guest on the show this morning, and she was so excited about that. And so great people doing great work. So one thing I wanted to announce on the air is that we are in talks, St. Johns County Council on Aging and Epic Behavioral Health Care, exploring a partnership so that we can expand mental health services for our senior community. This is an important step toward meeting a growing need, and we look forward to sharing more details as they develop. But in the meantime, I'd love for you to talk about why you are enthusiastic about strengthening support for our senior population.
So I have a soft spot for the senior population and have since I was very young. I would go with my grandmother to deliver Meals on Wheels. And the recipients always struck me as very lonely. Not always, but most of the time.
Sure.
They were more excited to see me than they were to see the food.
Absolutely.
Later, after becoming a nurse, I've been nursing for 36 years. I worked in long-term care for quite a few of those years. And I truly believe that this is an underserved population, often forgotten, and they have limited affordable resources offered to them. That's just my opinion. And this is why Epic chose to approach you, Brian, and your COA team to partner and offer services to seniors where they are so we can actually go into the home. We know that sometimes they don't have transportation or they have limited transportation. They may have limited financial options. If you look at the cost of living in St. Johns County and today's, if you're on a fixed income, it can be a challenge. So we can help. It doesn't matter if you have a payer or commercial or Medicare. We do take Medicare Part B, and we have other commercial insurances, but we also help those who are uninsured. So that's not a barrier to care, and I really want to reach out to that population that I do feel actually the suicide rates and those 61 and older in St. Johns County and nationwide is on the increase.
It is. And, I was recently talking with the sheriff, and, he has the very unfortunate experience of reading a lot of the suicide notes from the seniors who take their own lives. And for some of them, they're at that point where they're in a financial crisis, and they don't want to be a burden to their family.
Yes.
And so they would rather take their life than try to, reach out for help.
Which is heartbreaking.
It is. It's very heartbreaking. And I say this all the time. Like for me, I'm 53 years old. I love doing what I do because I'm serving the generation that raised my generation, right? We should be taking care of them. They helped us, right, get prepared for adulthood. They were our parents. They were or even grandparents, right? They were our teachers. They were our the law enforcement, making sure we stayed on the right path. They were our coaches and nurses and doctors. I mean, you can just go on and on and on about all the different careers that they held to help us be prepared to live adulthood. And we should now be there for them. We should be taking care of them. So I'm very excited about this, this conversation and this dialogue that we're having. We're still in the process of working out all the details. And so stay tuned. We'll have more details in the near future of how this partnership is going to evolve and what we're going to be able to do to help seniors with mental health, different mental health options. And so we're looking forward to that. So also, as we got a few minutes left in our show this morning, what about new programs and services starting soon at Epic? And then what are some things that you would love to start in the future? Like, I'm sure you have a wish list of things that you want to do. So, but something new that's coming up that, in the very near future, and then things in the distant future that you would like to see happen.
Yeah, so we're excited about our mental health court implementation plan. We have applied for that grant. We're the only ones in St. Johns County that did apply for it because you can only have one. We had a year-long planning grant that we did with Circuit 7 and many of our constituents in the community, and we're hoping that we will be awarded that in the next couple of months, and then we'll start in October. That is a specific specialty court, kind of like veterans court and drug court, but it helps divert folks to get services outpatient versus incarceration. Jail is not the place for people who are living with a severe mental health issue. So we're hoping to start that this fall. If that would be in October, like I mentioned. My hope for the future is to continue to expand treatment options and decrease negative stigma through community education and awareness. It's an ongoing.
It is ongoing.
Focus.
Absolutely. Yes. And we just have to keep doing our part.
I agree.
I love that the Board of County Commissioners, just a couple weeks ago, they did a proclamation at the meeting,
For mental health.
For mental health, and got to be there for that. And so it's good to see those things happening, and when those things happen, then that just reduces the stigma.
Yep.
It slowly reduces the stigma. So everybody, we all need to do our part and just be an advocate for it. Mental health is health.
It's true.
And
there's hope.
And there is hope, and great places like Epic Behavioral Healthcare and others throughout St. Johns County providing great services for folks. And I'm just so thankful for all of them. So with the mental health court, I would say when I lived in West Virginia, I worked in the magistrate court. I was in ministry, and I pastored a small church, but they couldn't pay me very much. So I had my second job that actually gave me a salary, was in the magistrate court. That's the lower court in the court system in West Virginia. But in the circuit court, which was the next level up, they started a mental health court. Yeah. And so, and then it did very well. It had tremendous results. And it wasn't just there; it was throughout the entire state of West Virginia. So I'm so excited that you're getting this started, and I think it's going to be a great resource for those. Like you said, jail was not a place to be if you're dealing with the mental health illness or crisis. And sometimes I think that's been where folks have gone because we didn't know where else to put them.
Right. Right. And we're very fortunate that Sheriff Hardwick is very aware of that. So he has done a tremendous job developing teams to help people get coordinated care outside of the jail.
Yeah. All right. Well, that music means it's time for our show to end. Nangy, thank you so much for being here.
Thanks for having me.
Always good to have you in the studio. Thanks for listening, everybody. Next week, we'll have Megan Wall in the studio to talk about legal matters. Till then, have a great week.